First, I wanted to start out just showing you where you're going to actually place your chest piece whenever you're listening to the heart. And I like to start in the aortic and work my way down. Remember the mnemonic. All patients take medicine, and Erb's point is in between the pulmonic and the tricuspid. And whenever your semilunar valves are your aortic and pulmonic, and when they close, you hear S2. So you're going to hear S2 the most at the base of the heart, and then whenever you're hearing the tricuspid and mitral, which are your AV valves, you're hearing S1 whenever they close. Aortic over here, then I'm just going to inch over here to the pulmonic, inch down to Erb's point. Now I'm going to inch down to the tricuspid, and then I'm going to go over to the mitral area.